Hi, everybody. This is Dr. Sonia McGowan, and I'm so glad you're here with us today. We're going to give people just a minute to come in the room and get settled and get ready to go. So I'm a little bit of a time compulsive person, so we won't wait too long. For some reason, there's a little glitch in my slide. It says as the title, 5 supplements to consider for complex kids. So that was last month's webinar. If you haven't seen it, it was fantastic. You can access the replay link if you registered, or you can go to thewhymatters.net and you'll find all of the replay links for the webinars that I've done in the past. So ignore that little glitch. We are talking about chiro and kids today. So everybody come on in, get settled. We'll go ahead and get started. If you have any questions, you will see a chat box. Go ahead and put your questions in the chat or the Q&A box. And as they come to you, just put them in and I will answer them as I can, or for sure, I will answer them at the end. All right, so one of the things that I am asked all the time is, why on earth would I bring my kid to a chiropractor? Well, that's interesting because I am a pediatric chiropractor. My practice is almost completely made up of prenatal chiropractic, so patients who are expecting, and then newborns all the way through teenagers. And a great deal of those are complex kids. And, the things that we see, outcomes that we see with kids in chiropractic is amazing. So if you don't know who I am, again, I'm Dr. Sonia. I have a multidisciplinary practice in Jefferson City, Missouri. And as you can see here, there on the left is my husband, Shannon. He is a CPA. He works for a firm out of Iowa, and his zone of genius is agricultural accounting. He's a genius. We have a daughter who is named Libby. She is soon to be 20. She's a musician and an audio engineer, and she lives in Kansas City. And then our son, Rowan, is 18, getting ready to leave for college. He was a complex kid when he was a little guy. We have overcome all of those challenges, and he is getting ready to move to Illinois to go to college as a musical theater and costume design major. So we're pretty proud of him. And then we've got that picture up there. I really need to change it. That's our Lola. She was our English bulldog. We had her for almost 10 years. And she recently passed away, so we still really miss her. And then that picture on the lower right-hand side is a dear person to me. His name is Mitch, and that's his dad, Ron. Mitch was a really complicated guy. He was identified as being profoundly mentally retarded, but when given the opportunity to communicate through spelling, it was determined that he was actually a savant. And so he was a big reason why I have the practice I have today and why I designed it the way that I have. So as I mentioned, we're a multi-specialty interdisciplinary clinic here in Jefferson City. So a great deal of the work we do is with complex kids. What do I mean by that? I mean kids with autism, kids with ADD, ADHD, kids who have, any number of behavior, language, socialization challenges. And by that, I also mean, kids with sensory problems, kids who, what I call round peg, square hole kinds of kids who don't necessarily have any sort of diagnosis. They're not identified as anything in particular, but they're struggling. They're having trouble in school. They're having trouble sleeping. Maybe they're constipated. Selective eaters, maybe they have tongue and lip ties. So that's really our jam, is working with kids that it seems like no other doctors seem to understand. One major component of our practice is what we call the spot for TOTS, and TOTS stands for tethered oral tissues. And so by that we can mean lip tie, tongue tie, buccal ties. And so we do comprehensive evaluations and interventions for oral restrictions, including craniosacral therapy, feeding therapy, myofunctional therapy, and chiropractic. We don't do the releases here. We're not qualified to do that, but we do have a couple of dentists who are our referral partners. So we send all of our kiddos to specific providers to have that done. And like I mentioned before, we have a moms and babies program. So one of our taglines is that we start early. And so as soon as moms find out that they're expecting, we love for them to come right in and get adjusted. And we follow moms through their pregnancy, and then we start following babies as soon as they're born. Again, we do chiropractic. We have hyperbaric oxygen therapy here. We have ion cleansed foot baths. We do nutrition testing. And then as of January, we have brought on Dr. Hannah Strong, who is a pediatrician. She's a DO trained in pediatrics. And so you can check her out at covenantpediatrics.net. She is a lovely and valuable part of our practice. All right. And so the why matters. We have to know the reason behind kids' behaviors, behind their socialization and language problems. Kids don't misbehave on purpose, right? There are no purposeless behaviors and there are no bad kids. And what we really strive to figure out is, why is the kid having this particular challenge? And when we understand the why behind the complex kid's behavior, suddenly we can change those things and things start looking a whole lot better. And we love to say we make the tiny mighty, because we sometimes, work with the hardest of the hard kids in cases. And we're really, really great at getting fantastic outcomes with the kids that other doctors don't understand. And so what we know is that special needs, any kind of complex needs, require really special techniques. And so that's what makes us different, because our team is experienced. We've worked with all ages, every diagnosis you can think of, every kind of presentation or challenge. We start early and we don't wait. We are not a doctor's office who will say to you, oh, let's give it 6 months, or, oh, let's give it a year and see how they do. We identify even the most subtle signs early so that we can avoid the progression of symptoms, right? We nip it in the bud, we get it taken care of, so it's not a problem going forward. And because we take such a comprehensive approach, we come at this from all different multiple avenues. And so I think that's another reason why we get such great outcomes with kids. So let's talk about chiropractic. So, we go to school for a really long time. Most programs are between 3 and 4 years, depending on which school it is. It's incredibly expensive and it's a rigorous program. And I think, a major misconception of chiropractic is that it's all about just popping your back, right? That if you have a headache or you've had whiplash, you've been in a car accident, your back hurts, you have sciatica, that's what you go to a chiropractor for. And overall, yes, that is absolutely true. Your general chiropractors do exactly that, and they do a phenomenal job. Although that really isn't what we concentrate on here. So when we talk about kids, we use really the spine as just an entry point to the nervous system. So the primary function of the chiropractic adjustment is to regulate the nervous system. Because we know that spinal misalignments negatively affect neurology, we're specially trained to take care of that, because structure impacts function. And I often say, and people say this about me a lot, is that I am not your average chiropractor. So first of all, I'm a pediatric chiropractor, and that was my goal from the outset. From day one of chiropractic college, I said I wanted to be a pediatric chiropractor, and most people looked at me like I was kind of crazy. And then when I said, and yeah, I want to work with kids with autism, they really looked at me like I was crazy. So most doctors, chiropractors, focus on the alignment of the spine. We focus on the nervous system. Again, the spine is just the entry point. And so we concentrate on the tone and the coordination of the nervous system, because, our buzzword is subluxation. So when a bone is out of place, misalignment, so it could be out of place or it could be fixated, meaning it's not moving in the way that it should. And those are the things that will affect the tone and coordination of the nervous system. And so it's more than just being a bone out of place. Again, it's misalignment, it's fixation, it's stress. And so for kids who, let's say, have some behavioral problems, or maybe they're selective eaters, or maybe they're not great sleepers, maybe they aren't great poopers, right? All of that together tells me that their nervous system is not in balance, that most likely they're stuck in fight or flight and they're not moving easily and fluidly, appropriately from fight or flight into rest and digest. And so you cannot heal and you cannot learn when your nervous system is stuck in fight or flight, right? So imagine, if you've got a bear chasing you, you don't care about learning algebra, right? There's no way you can do that because your body is and your brain are too focused on survival. And that's what we really see pretty commonly with many, many kids. And so we know that the autonomic nervous system controls everything. It controls digestion, it controls your immune system function, sleep, language, motor development, all of that. And increased stress changes the way the nervous system functions. And once those changes are present for a long enough time, then those changes become the new normal. All right. So with prenatal chiropractic. So again, we start early. We start with moms as soon as they come in, finding out that they are expecting. We do something called the Webster technique, and this is for optimal fetal positioning. So when it's time for baby to be born, they need to be head down. That is the optimal way for babies to be born. Of course, they can come feet first, but we don't love that, right? We don't like when babies come breech. And so the Webster technique is a way for us to balance the pelvis so that the body can have optimal positioning for that baby. If the fetus is restricted in utero, it will be restricted after birth. And we also know that faulty or inaccurate sensory information alters our motor output, right? So think about if you've ever had vertigo, it's a horrible thing, right? Your body thinks you're unstable. You have the room spins, your body, your brain thinks your body is moving, but it really isn't. And so what happens? You stumble, you fall down, you feel nauseous, right? So that inaccurate sensory input alters your motor output. And the effects of altered output can start before birth. So that's why we want to work with moms, make sure that we have optimal fetal movement and positioning in utero so that when baby is born, they are balanced and have a healthy nervous system. And so we know that maternal stress can definitely affect baby. So things like fertility challenges, things like stress at work with relationships and money, stress on that mom affects the baby. That umbilical cord is like a lifeline, of course, to baby. And so that means that mom's nervous system becomes baby's nervous system. And so a stressed mom means a stressed baby. And most births are really traumatic. And so birth interventions affect the least protected anatomy in a baby. So if you look at these pictures, if we have assisted birth with, for example, forceps or vacuum extraction, that puts a great deal of stress on that baby's very pliable and vulnerable head and neck area. And so when we have these sorts of birth interventions, it can be very difficult for the infant. And we know that traumatic births really affect babies, whether it's forceps, whether it's just a great deal of force being placed on that baby's head and neck as they're being delivered. The traumatic birth really affects baby. Excuse me. All right. And so, again, more pictures that just show you how much force is placed on a baby's neck. How can that not affect them, right? So, with pediatric chiropractic, one of the things that we really focus on is assessing movement, because we know that movement is life. So we monitor any kind of lack of proper movement. We watch motor development because we know that motor development drives brain development. And so let's say a baby isn't rolling appropriately equally from one side to the other, maybe they're not crawling in exactly the right way, then we know that that is going to change the way the brain develops. So a baby's initial motor development and control is the head, neck, and jaw, right? Because that baby needs to nurse. And so how can that head, neck, and jaw be okay after a traumatic birth? And so we also assess symmetry. So we're looking at any sort of asymmetry in the face, head, or jaw, right? So we're looking at that structural misalignment. We're looking at any sort of structural difference because a structural difference means a functional difference. And we also know that functional differences affect feeding, development, and behavior. And structural differences lead to behavioral and neurological issues. So for example, if you look at this picture of our sweet little patient, you can see some asymmetries, right? You can see that her right shoulder is high. We can see she's got a little twist in her pelvis. She's got one foot that flares out. And so if I didn't have a smiley face over her head, you would see she's got a little bit of a tilt to her head too, as a general posture for her. And so we know that these sorts of structural differences change the function of her body. So we work to correct those things. Of course, we monitor milestones. We want to be looking at early head control, rolling. We want to look at muscle tone, the way a child is growing. And then, of course, we can help parents guide development. So we talk to parents all the time about tummy time, about pacifiers, about what is the best sort of cup to use. We talk about food. We talk about sleep. All of those things are very critical for new babies. One phrase I catch myself saying all the time is that something might be common, but it doesn't make it normal. And so, for example, a loss of movement leads to a loss of perception and coordination. This loss of perception and coordination changes the tone of the nervous system, which reduces what we call proprioception or a knowledge, a sense of where you are in space. And it increases nociception. Nociception is a pain reception. So this leads to changes in developmental milestones. And when a baby skips milestones, that changes the brain. And it prevents the brain from developing appropriately. So an example, my son, when he was tiny, I wasn't a chiropractor when he was born. And so I thought he was a tiny baby genius because he was... in his baby book, I wrote, "No one will believe this, but Rowan just rolled over at 3 days old." And I thought it was great. I was like, wow, he's a baby genius. I didn't know any better. I didn't know that he should not be rolling over that early. When he was in the nursery right after he was born, he was trying to hold his head up. He was, pulling his hands out of the swaddling blanket. And, everybody was like, wow, look at this baby. He's really something else. But really what that spoke to was too high of tone in his nervous system. He, and then subsequently was not a great pooper and he wasn't a great sleeper. And, so we had some challenges there. The other thing that we see a lot, and this happened with my son as well, is sometimes babies are eager to skip crawling. And that is not a good thing. Babies absolutely must crawl. We don't want them skipping that milestone because when a baby is on all fours and they're crawling appropriately, what's basically happening is you're improving that communication between each side of the brain. So you're building that bridge between the right and the left hemispheres of the brain. Lots of other good things happen when you crawl too, but that's very, very important. And so Rowan, he basically wanted to go from laying and sitting to just running. And so he did not crawl very long at all. And it definitely set his nervous system up for some issues, as well as, some sensory issues and other proprioceptive challenges. So again, this increases the tone of the nervous system. What happens is kids get stuck in fight or flight. Again, like I said, you can't learn, heal, or grow when you're stuck in fight or flight. When you're in fight or flight, it reduces your ability to digest food. So your gut motility decreases. It increases your responses and reactions to toxins and pathogens. and it increases inflammation. So it's really, really important that kids make it through each of those developmental milestones adequately and for enough time. So kids really, really need chiropractic care. Most of the symptoms babies and children exhibit are usually overlooked, they're disregarded, they're ignored, they're minimized by their primary care providers. We have lots of families who bring their kids here and say, I've been to all of these places about my child's problem, whether it's, sleep issues or constipation or behavior problems, lack of language, lack of crawling, not rolling, tongue ties, etc. And most of the time, these families are, again, their concerns are minimized or ignored. Their primary care doctor tells them, let's just wait and see. And, I'm not throwing shade on other providers. It's just, people know what they know. And when you know better, you do better. And so we learned and we taught ourselves. And so now as providers, we try to do the right thing. And so we are brain, not pain at our clinic. And so we're very particular about who we take on as patients, particularly adults. If you're just a pain patient, you're not a great candidate for us. We will gladly refer you to someone down the street who's really, really great at handling pain. And so we know that when you change structure, you change function. And so we do that by using chiropractic adjustments, craniosacral therapy, feeding therapy, myofunctional therapy, lactation consultation if it's needed. So babies really need chiropractic care, especially if they have had in utero positioning challenges. So maybe they're a baby who doesn't move very much. Maybe they're transverse. They're kind of stuck side to side. When it's time to be born, they want to be head up. So any sort of positioning challenge, babies who have colic, who are irritable, if they cry inconsolably, they're very hard to soothe. Those are the babies who need to come see me. Babies who tend to keep their thumbs tight like this, or they tend to keep their toes clenched under, those are babies who have a high tone and need to be adjusted. And then any sort of feeding or nursing challenge. I love this picture. This is me, of course. This is my daughter, Libby. When she was 17, we discovered she has had a severe lip and tongue tie. So ironic, right? So we had that corrected, and it was amazing, the changes that we saw in her. So the babies who definitely need chiropractic care are those who can't turn their head equally in all directions. So it's really common for moms to say to me, yeah, he's nursing great on my right side, but not on the left. And so that's really a symptom that, they're not able to turn their heads in both directions equally. That's definitely a cervical spine issue that we need to address. Also, any rolling or turning that's unequal bilaterally. So if a baby can, roll from their belly to their back going to the right side, but not the left, that's a problem, for example. Any baby who is resistant to tummy time, there's a reason for that. It's not just personality. And tummy time is absolutely a critical activity. It's a critical part of development. Babies must spend time on their bellies. We call it a prone position. And what I say is prone makes tone. If babies don't lay on their bellies enough, they don't have the appropriate development on their backs, right? The muscles on the backside of their body to help them sit up appropriately, to help them have good posture, to sit up once they get to kindergarten, sit at their desk and pay attention. And if they're fussy in a certain position, like when you put them in a car seat, they growl about that. If they don't like to be laid flat on their back, etc. So any particular position that makes them crabby is a reason to bring the baby to see us. Also, any sort of asymmetry. So if you see a face that's asymmetrical, maybe one eye is higher than the other, or maybe it's more anterior than the other eye. If, the ears aren't quite straight, if one side of the face is bigger than the other, if they have a head shape issue, so maybe they have a flat spot on one side of their head or on the back part of their head, it's very, very important that they be seen by a qualified pediatric chiropractor right away. Also, another asymmetry is what we call torticollis. So that's when a child's head is sort of stuck like this. So we've got some rotation with lateral flexion. And so this sort of position, if it persists, will change the shape of the face because the brain wants the eyes level with the horizon. And so if baby is stuck like this, the body will change and make the eyes one eye higher than the other so that it's level with the horizon. We will generally see one side of the face grow larger than the other. The nostrils will change orientation as well. So again, any asymmetry in the face, in the head, any kind of torticollis, baby absolutely needs to be seen by a pediatric chiropractor. Any sort of difference in facial development, I've kind of covered that already. Also head control issues. So it's not a good thing for a very new baby to be able to hold their head up, right? They're not ready to do that yet. So babies who have too much head control, that's a concern, but also babies who have too little head control. So, if they're several weeks old and they're still having a lot of head lag when you pull them up to a seated position, or they're not able to stabilize their heads and necks very well at all, that is cause for them to be seen. Any sort of issues around milestones, so skipping them, reaching them too soon, having delayed milestones, definitely a good reason to bring your kid to see me. And then tone imbalances. So if we see, maybe a really tight muscles in the neck on one side, but not on the other, or we see maybe a little curvature in the spine causing, muscles on one side to be tight and the other side not tight. Those are reasons for a referral to us. And again, postural issues. We see so many postural issues in kids of all ages. Not so much with babies. This doesn't apply, but older kids, always looking down at their devices. We're seeing lots of kids who are sort of hung up in a flexed position and they're not great at extending. But any kind of postural issue with a baby, for example, if you lay them flat on their back and they kind of bend to one side, that would be a good example of a baby who needs to be seen. Mouth breathing, so breathing through the mouth instead of the nose, any sort of reflux, belly aches, colic, poop issues. So a baby should have a really good, nice poop multiple times per day. And if they're not doing that, they absolutely should be adjusted. Any sort of allergies, eczema, ear infections, those are conditions that generally are symptoms of more complicated issues. And so a baby really should be seen right away. And then sleep challenges as well. So babies should eat, sleep, and poop easily, effortlessly. Babies should be happy. They should be calm and content. And if they are not, we are definitely the best doctors for them to see. So many people have been adjusted and as adults, and they know some doctors can be really forceful. And sometimes we need to use a little bit of force to get those segments to move. But when we're talking about little kids, the adjustments are very gentle. So we do an incredibly thorough exam, no matter what the age. And our approach is very gentle. It doesn't take us very long. Once we've done the initial exam and you're seeing the child for a subsequent visit, the adjustment itself really doesn't take very long, but it's quite powerful. Often we use a fingertip contact only, maybe the tips of our thumbs, maybe our pinkies or the tips of our index fingers. It's exceedingly safe. There is absolutely no danger in having a qualified pediatric chiropractor adjust your baby or your child. There are no side effects except better appetite, more sleep, and big poops. Those are the three things I always tell parents. Get ready. I'm great at, ruining diapers and sleepers and car seats because often a kid will have a big blowout poop before they ever leave the office. Many babies sleep right through their adjustment. And keep in mind, not all chiropractors are pediatric chiropractors. I have had hours and hours of training beyond graduation to make me a qualified person to see babies and kids. So what are the improvements that we see? So generally, what we see is an improvement in motor coordination. We see improvements in the way kids are able to move and coordinate their eyes together. We generally see good improvements in posture and in immune responses. Also digestion, which equals poops, sleep, and then behavior, language, and socialization. All of those things are things that we see generally dramatic improvement with kids. And so let's talk about complex kids. We see a lot of them here. And what I generally will tell parents is that kids don't grow out of things, right? They don't grow out of early challenges like colic. They grow into other problems like sensory processing issues, sleep dysregulation, issues with focus and attention. And so while early challenges may be common, they are not normal. This is why we don't ignore. It's why we don't wait and see, because we don't want something like colic to grow into a more difficult situation later. So let's talk about a couple of kids. So this first little guy is named Eli. He came to me with bounds of energy. He was a very, very busy boy. Lots of very troubling behaviors, difficult for parents and grandparents to handle him. He is incredibly intelligent, has excellent language, but his behavior was just exceedingly difficult. And so we started out with chiropractic adjustments a couple of times a week. We did that while we were waiting for some functional nutrition testing to come back. And Eli didn't love it at first. He would crawl under the table. He would scream and cry. Within just a handful of adjustments, he was sleeping better. He was very cooperative. He would come right in. He would lay down, get his adjustment. We'd have a great time. He'd get something from the treasure box and out he would go. So we're seeing really, really dramatic changes in terms of his behavior, his language, his socialization skills in a very short amount of time. The little guy in the middle is named Bowman. And Bowman came to me primarily because of constipation that was chronic. And as he became more constipated, he would develop a stutter with his speech. So a disfluency with speech. So the less he pooped, the more he stuttered. And he was in, quite a lot of pain because of this. And the less he pooped, the more troublesome his behavior became. He's generally a very docile, sweet, loving child, calm, easy to get along with. When he doesn't poop enough, he gets a little bit busier, a little less compliant. And so, again, we started adjusting right away while we waited for some other functional nutrition test results to come back. And we are making very nice progress. He is definitely, his poops are changing. We're not there yet. We haven't been at it all that long, but we're definitely seeing some really dramatic improvements with Bowman already. And then, of course, we have our sweet little Emerson. Emerson may be the smartest and chattiest almost 4-year-old I've ever met. Everybody just loves her. But she was really having a lot of behavior problems at preschool. So she was turning over chairs and turning over desks and screaming and crying and couldn't play with her friends and couldn't cooperate with the teachers. Lots of energy, lots of nonstop talking, just a lot of difficulties. And so, again, we're not there yet with her, but we're seeing really dramatic improvements in her ability to calm her body, to be able to just function in her preschool classroom. She's not getting in trouble anymore. She's not misunderstanding cues from her peers. She's able to, follow the routine and do what she needs to do both at preschool and at home. So really dramatic changes from almost immediately after being adjusted. So again, always keep in mind that the why matters. There are no bad kids and there are no purposeless behaviors. We have to find the why behind the behavior, socialization, and language challenges that kids have. And when we do that, we can make long-term changes for the better. So if you want to get in touch with me, you can find us at covenantwellness.net, covenantpediatrics.net as well. We do offer a monthly webinar. Generally, it is the first Friday of every month, just like today. And so if you want to access the webinars that I've done in the past, you can go to thewhymatters.net and you'll see not only our webinars, but we have a podcast as well that you are able to listen to. We talk a lot about kids and complex needs. We talk to professionals and parents to hear their stories and the things that have been found to help our kids with complex needs. If you would like to email me, you definitely can, Dr. Sonia at covenantwellness.net. I am taking new patients, both complex kids appointments and new patient chiropractic appointments. We are bringing on an associate doctor in September, and she'll be taking new patients as well. She also is quite experienced now with pediatrics, with babies and expecting moms, complex kids. So we will have even more appointments open for parents who are interested in seeing us. So again, if you have any questions at all, don't hesitate to email me. And if there's anything we can do for you, if you feel like our clinic would be a good fit for you, definitely give us a call. Thanks so much, guys. Have a good day.